Hello, this is Corinne Scott from Section 001, and this is my Exam 1 remediation. So the first thing I'm going to talk about are the parts of a needle and syringe. So the first part is the barrel. So barrel is the part where the medication is held. Then we have the tip, which goes on the end of the barrel. Then the hub, which is where the needle can be attached. Then the shaft, which is the body of the needle, and then the bevel, which is a part of the needle that actually goes into the skin for the injection. Next up, I'm going to be talking about needle gauges. So the gauge of a needle can be defined as the diameter of the needle. This ranges from 18 to 30 gauge, and with this, the smaller the number is, the larger the diameter. So for example, an 18 gauge is actually bigger than a 30 gauge. Continuing on with the theme of needles, we're going to talk about disposal of contaminated needles. So the first thing to really remember is never to recap the needle. So always wear gloves. Don't recap it when you're walking to the sharps container. And then it's also important to use the one hand technique so that you can prevent injury from any people who are walking in or out of the room. Up next, I'm going to discuss drawing from a multi-dose vial. So the first thing you want to do is find the dose volume, and obtain a second form of verification. That can be asking another nurse or double checking a different location in the chart. First, you're going to perform hand hygiene. Then you're going to put on gloves, clean the top of the vial with an alcohol pad, remove the cap of the needle, draw sufficient air into the syringe that is equal to the amount of the dose, place the vial on the counter, insert the needle, keep the plunger depressed, withdraw the ordered dose, remove the needle from the vial, release any excess air, and then lastly, you're going to check to make sure that the volume of the dose is the same amount that was ordered. So next we're going to talk about two types of injections. We have intramuscular and subcutaneous. So with intramuscular, you're going to inject in the ventrogluteal, vastus lateralis, dorsogluteal, or deltoid muscle regions. And then for subcutaneous, you're going to inject in the outer portion of the posterior upper arm, the abdomen, the anterior aspect of the thigh, the upper back, or the upper ventral or dorsal gluteal area. And next up, I'm going to talk about acidosis and alkalosis. So acidosis is a pH of less than 7.35 to 7.45, and this is due to an excess of HCl or hydrochloric acid. And alkalosis is a pH higher than 7.35 to 7.45, and this is due to excessive amounts of NaCO3 or bicarbonate ion. So next up, I would like to discuss respiratory acidosis and respiratory alkalosis. So respiratory acidosis is caused by an excess amount of CO2 in the lungs. So the lab values show a decreased pH, so less than 7.35 to 7.45, and we're going to see an increased CO2 concentration in the blood, and that's going to be greater than 35 to 45, which is the normal range. And then for respiratory alkalosis, this is caused by too little CO2 in the lungs. So we're going to see an increased pH, so greater than 3.75 or 7.35 to 7.45, and a decreased CO2 concentration, so less than 35 to 45, which is the normal. So to continue our theme of the lungs and breathing, we are going to talk about suctioning. So the steps in performing suctioning are hand hygiene, setting up your equipment, pouring the saline solution into a sterile container, using the obturator nerve to determine that your placement and your depth is correct. Then we're going to apply gloves, use the thumb of your non-dominant hand to cover the end of the suction tube, and your dominant hand is going to remain sterile, and that's going to be used to insert the suction catheter. So you're going to use gentle circulation upon removal, and use suction for no more than 10 seconds when you're removing it. After you remove the catheter, you're going to rinse with saline, and repeat this up to 3 times in order to prevent tissue injury or tissue damage. And that concludes my PowerPoint presentation for my Exam 1 remediation. Thank you for watching, and I hope you have a great weekend.